Hi, my name is Debbie Eastman. I'm the Simulation and Nursing Lab Coordinator at Washtenaw Community College, and I'm here today to give you a quick tour of our simulation lab so that you can know what to expect when you walk into this lab. We're going to start out with Noelle, who is our simulation birthing simulator, and she is able to only do a few things. She's not able to talk. Clearly she doesn't walk, but she is able to give birth to a baby. Once she's given birth to a baby, many times we place the baby into the warmer, and we're able to work with the baby and teach you how to work with the baby. None of this will take place until you actually get into your maternal child course, but we just wanted to give you a chance to actually see some of this setup. We also have cribs that are available that we use during the maternal child course that you'll be taking, and multiple babies. In this area, we also have 2 overhead lights that we may be using. Just wanted you to be aware of that. We have bedside drawers and dressers full of supplies, so that you'll have this as access for alcohol wipes, tongue depressors. We have various supplies in here, gloves, as well as gauze pads. We also have, next to each one of our simulators, wall units that have suction, which does work, and we also have oxygen, but unfortunately these do not work. We do not have piped in air at this time. It's something that we are hoping to get in the future, but when you are actually doing a simulation, you would turn on the oxygen and tell us that you are turning it up to 2 liters, so that we at least are aware that you are doing something in order to assist your patient if they require oxygen. In about a minute, I'm going to walk into the back of the room, and I'm going to show you where our supplies are at. Now I'm in the back of the room. As you would walk through the door off the hallway, this is one of the first things that you would actually see. We do have a sink, we have towels, we have soap. Clearly we want you washing your hands before you do any kind of procedures. We also have multiple supplies in here in order to help you with your scenario, so that you can actually perform various tasks. We have a drawer that has IV tubing in it, so that if you have to change IV tubing or you need to start a new IV, we have this available to you. We have IV fluids in this drawer. Underneath these 2 drawers, we have pillows and blue pads in case you need to get your patient more comfortable. This drawer contains Tegaderms, alcohol wipes, and needles, as well as tape and medication cups. And the very last drawer contains sterile gloves, as well as syringes and pre-filled normal saline syringes. Underneath that, we do have linens. They're not stocked very well right now, but when we prepare for a simulation, we do stock our items so that you have access to that in case you need to do a bed change. All of the cupboards above the cabinet, or all of the cabinets, I should say, above the sink level will be locked. There is nothing up there that you need to get to in order to be prepared for a scenario. I will be shortly moving into showing you where the Medi and iStan human patient simulators are. So as I would enter off of the hallway and come walking past our cabinets that contain supplies, I would be moving towards MediMan, who is our 2nd generation simulator. And in 1 minute, I'm going to show you how MediMan works. So this is MediMan. He is our newest simulator. He is also known as an HPS, or Human Patient Simulator. We have both our simulators in automatic beds. He is dressed as a male. However, if the simulation required that we use a female, we would oftentimes put wigs on them, jewelry, and various other items so that you would know that this is a female. Currently, Medi has an IV running in him. What we're able to do with him based on the scenario is to do a full assessment. So he has lung sounds, heart sounds, he has pulses in all the areas you would normally find it on a human. He can blink, he can talk, he can bleed, he can cry, he can spit up, he can drool, he can sweat. He has many things that he can do physiologically. However, what he can't do is get up out of the bed. He cannot squeeze your hands. If you were asking for equal hand grasp, he wouldn't be able to do that. he can't move any of his body parts. We often do the talking for them, although they do have a voice box and they are able to do some speaking as long as we have the opportunity to push a button and make them cough or cry or do various things. But usually one of the simulation techs is speaking for the mannequin and responding to you when you're taking care of him. The heart sounds sound like they're ticking. The breath sounds can sound like wheezes or whatever breath sounds that we would put into him. He has other anatomical parts that we were able to use in case we were going to require a Foley catheterization, something like that. And so you would treat him as if he was a real patient, even though there are some limitations with him. Again, you can see the same setup as what we saw with Noel. You still have the bedside table with all of the supplies in it. We have a code blue button in case you would have to do compressions or call a code. It does not ring. It doesn't call into anywhere, so we would ask you to say that you are pushing the code blue button so that we would know that that's how we're progressing the scenario. We also have the wall units. Again, you have vacuum and you have oxygen. Just remember that you don't actually have an oxygen or air supply that will float the ball that's in our oxygen monitor. We also have gloves that are on the wall. You may not be able to see those right now. I will point those out when I move over to iStand, but next to each bed we have a variety of gloves that you would be able to use to take care of this patient. Now I'm going to move over to iStand so that you can see our second human patient simulator. I'm now over at our second human patient simulator. He is directly across from MediMan. The way our simulation room is set up is similar to what you would see in an ER. It's considered bay style. We don't have separate rooms, but we are able to separate the beds by using curtains. iStand is our first generation simulator. He's able to do all the same things as MediMan, and of course he has the same limitations. Currently he's dressed up as a woman. He does have IV solutions running right now for a previous scenario that we were able to do. Again, same setup with the bedside table, the vacuum, and the oxygen. And as you can see, he is in the same space that Noel occupied and has the overhead lights as well. He also has a chair. Both monitors are available as well for Medi and for iStand. This is called a waveform monitor. I don't have anything up on it right now, but you would see when he's actually running a heart rate with a rhythm, respiratory rate, blood pressure, and body temperature. Those are the typical waveforms that you would see on a monitor when you're running a scenario. We also have next to that a bladder scanner in case you needed to check to see if the patient's bladder is full. It is a fully functional bladder scanner. And we have many other supplies that we're able to bring in based on what the scenario calls for. Now I'm going to move over to our medication dispense equipment so that you can see what we have in order to support the scenario. Now I'm standing next to our med dispense machine as well as our teaching desk. The teaching desk has a monitor on it that you're able to use if you need to look up medications. At Washtenaw we use Micromedics. There are several other places that you can go on the World Wide Web in order to find different types of medications, Hippocrates or Lexicon, but we're using Micromedics. You won't be using any of the drug books. We no longer support that. We ask that you look up any medications using our PC. This is our med dispenser, which also has a computer system on it. This is how you access patient medications. Whatever patient you may be working on as part of your simulation, the name will be in here as well as the listing of medications. And we will show you how you can actually access the patient as well as the medications. Once you've done that, the medications will actually pop out for you in one of these cubicles. That will require about a 5-minute instruction on it, but it's very useful as you'll see these in the hospital settings. Behind me is Baby. He is our Medi-Baby simulator. We don't use him very often because he is so large and rather difficult to move around, but he operates the same way as our MediMan and iStan. This is something that you would probably see in pediatric simulation, but again, we don't use him that often. I'm now going to move over to our nurse server so that you can see where we keep some of our other supplies. I'm now standing at what we'll call our nurse server. On top of the supplies that we have in the back cabinets and drawers, we also have this yellow unit that contains other supplies that you may need for a scenario. As you can see, we have a backboard that would be used for CPR. We have several things on top of this cart. We have the needle dispenser, Sharps container. We have an AED, and we also have a machine that would be able to dispense nebulized medications in case we have a patient who has respiratory distress. And the top drawer contains bandages, tape, ACE bandages. We also have a couple of other supplies that you may need in case you need to do wound care. The second drawer contains all of our oxygen supplies, nasal cannula, masks, as well as a nebulizer. Our third drawer contains supplies that you would need in order to perform a catheterization, as well as if you needed to put an NG into one of our patients, and or if you needed to suction a patient as well. The very bottom drawer contains equipment, personal protective equipment in case we have an isolation patient, and it also contains some linens in case you need to change a bed. In behind all of this, we have several windows that you'll see, and that is where we keep all of our equipment, electronic equipment for running these simulators. We call it our control room. We will show you that at a later date when you actually enter into our simulation room. You'll be able to see where we sit and how we operate the mannequins. We also have, just on the other side of that wall, the control room, at the very front of the room, a space for you to document whatever procedures you've done. We also have a computer system that's available to you as well if you need to look up medications. And that's pretty much what our simulation room looks like. You're going to need to come through here and really touch everything so that you feel more confident in where our supplies are at. But we're looking forward to having you join us for the next 2 years.